What I'll try and do is cover the various forms of musculoskeletal infections over the next 30 minutes. We'll be basically focusing on the infections of the bones and the joints, including the vertebral column, and if time permits, we'll see a few cases of the soft tissue infections. So depending on the anatomic planes involved in the musculoskeletal infections, we can classify them as skin infections, which are called as cellulitis, facial infections, which are called as infective fasciitis, which can be necrotizing or non-necrotizing, muscle infections, which are largely pyomyositis, and if they progress, they can actually turn into muscle abscesses, bursal infections, which give rise to bursitis. These are the soft tissue infections. And then you have septic arthritis, that is infection of the joint. The cortex of the bone may get infected when it is called as osteitis, and when the cortex and the medulla get infected, then it is called as osteomyelitis. So with this brief introduction, we'll start with the topic of osteomyelitis, which is nothing but infection of the bony cortex as well as the medullary cavity. Now, as we all know, the infection to a bone can either spread from the blood circulation, either from a source which is adjacent to the bone, that is the soft tissues, muscles, or a joint, or it can occur after direct implantation, which can be secondary to trauma or an surgical intervention. So whatever the cause of infection, the first part of the bone to be affected is the medullary cavity, except for this type of infections where the cortex gets affected first and then the medullary cavity gets affected. So why this is important to know is because once you will have a focus of infection in the medullary cavity. Now this is more common in the metaphyseal region, because as we all know, we have read it right from the first year of our residency or maybe even from the MBBS days, that in a child the vessels, that is the diaphyseal vessels, are allowed to cross across the physeal plate. Infant, the blood vessels of the diaphysis cross across the metaphysis and reach the epiphysis. So any infections arising in the diaphysis can easily spread up to the epiphysis and also can involve the joint. Whereas in a child, that is after say 16 months of age, the physeal plates develops, and which does not allow the vessels to cross across the metaphysis. So it is not very common for the diaphyseal infections to involve the epiphysis. Whereas in adults, once the physeal plate fuse, again the vessels can cross across the metaphysis, and an infection which is arising in the diaphysis can extend up to the epiphysis and vice versa. This is this is important to know, because that will tell you which part of the bone you have to concentrate on while you are studying your radiographs. So once a part of the bone is affected, which is usually the medullary cavity in the region of the metaphysis. Now why this is common is because, as you can see here, the vessels usually reach up to the metaphysis and then they form sinusoids here in the region of the metaphysis, and in the sinusoids the blood flow is very sluggish, and the infections or the bacteria or the organisms which has caused that infection gets adequate time for it to proliferate and grow into a full-blown infection. So usually the focus will be somewhere in the metaphyseal region and in the medullary cavity. Then as the infection goes on increasing, it will cause occlusion of the vessels. There will be local to the adjacent subperiosteum and the surrounding soft tissues. So this is exactly what happens. This infection, this is the area of ischemia here. The infection has spread through the cortex into the subperiosteal region here and then into the surrounding soft tissues. And here you can see that there is new bone formation, which is called as involucrum. So this is the pathophysiological process which occurs in cases of osteomyelitis. So as I've already told,